Hello fellow future RNs and aspiring nursing students out there. Ang study hack natin for today ay requested of someone who is close to my heart. Shout out kay Maui Pombo, charot, Mervin Pombo, dry ito na. Okay, he requested ng ang differentiation ng hypothyroidism and hyperthyroidism. Okay, first study tip. Fellow future RNs, these conditions, hindi talaga sila difficult maintindihan. Provided na alam natin ang basic physiology ng involved na gland sa conditions na to. I am talking about the thyroid gland. Okay, kasi ang conditions na to, they are the exact opposite of each other. Alright? So, okay, let's go to the basic physiology of our thyroid gland. Okay, ito ang ating thyroid gland. It's butterfly-shaped and it's located dito sa ating trachea, sa ating throat. Diba kapag nag-a-assess tayo, yung pinapalunok natin yung patient, tapos pinapalpate natin. Okay. Before the thyroid gland produces and releases your thyroid hormones, meron mo ng signal na manggagaling sa ating hypothalamus. Okay, from the brain, hypothalamus. Sa hypothalamus, magre-release yan ng TRH. TRH. It's for thyrotropin releasing hormone. Thyrotropin releasing hormone. Si TRH, marireceive yan ni pituitary gland. Anterior pituitary gland to be exact, to be specific. Pag na-receive na yan ni anterior pituitary gland, si anterior pituitary gland magre-release ng TSH. TSH or your thyroid stimulating hormone. Ano ang function yan? Let the name help you. Thyroid is your thyroid. Stimulating is very self-explanatory. Stimulating. And hormone is, kasi nga hormone siya. So, ang function niya is to stimulate your thyroid gland to produce thyroid hormones and to release your thyroid hormones. Okay, ano ngayon ang ating thyroid hormones? So, we have T3 and we have T4. Meron pa yung isa, your calcitonin, pero ang study hack na to ay mag-focus lang tayo sa T3 and T4. Alright. Additional information. Narinig niyo na ba yung feedback mechanism na tinatawag? It is how our body controls and maintains certain levels of hormones in our body. Okay. Like for example, yung negative and positive feedback mechanism. For example, kapag marami na or enough na ang T3 at T4 sa ating body, it will send a signal to the hypothalamus saying, hey brain, enough na ang aming thyroid hormones, you can stop releasing your TRH and TSH. Okay, this same goes kapag masyado namang mababa or walang masyadong thyroid hormone sa ating bloodstream. The body will send our body will send a signal to the brain saying, brain, bakit ganun? Wala naman kaming masyadong thyroid hormones dito, kinukulang kami. Wala kaming T3, wala kaming T4. Then the brain, the hypothalamus will start releasing your TRH and the TSH from the anterior pituitary gland, and that would stimulate the thyroid hormones to create and release your thyroid hormones, which is the T3 and T4. Okay. Now, T3 is also called your triiodothyronine. Okay, triiodothyronine. Your T4 is called your thyroxine. Thyroxine. Okay. Ano ang functions ng ating thyroid hormones? This is very important. Bakit? Kapag alam natin, the easiest way to understand the manifestations of this condition is to understand the functions of your thyroid hormones. Okay. First, it aids in metabolism. Okay? That's number 1. 2, body temperature. Next, mood and excitability. Take note of your functions. Next, your heart rate. Kasama dyan. Blood pressure. Kasama dyan. And digestion. Let's move on to our conditions. The hypothyroidism and hyperthyroidism. Okay. Kapag naririnig nyo ang salitang hypo, that means down. Okay? Hypo means down. Sorry, mas kita ito. Hypo means down. Okay, ano naman ang hyper? Hyper means up or increased or elevated. So, let the name help you. Hypothyroidism means mababa ang iyong thyroid hormones or hindi masyadong active ang ating thyroid gland. When you say hyperthyroidism, overly active naman ang thyroid gland or masyado ka namang maraming thyroid hormones. Okay, another memory trick. When you say hypothyroidism, think of low and slow. Yan, maraming O yan, hypo, low and slow. And when you say hyperthyroidism, think of high and hot. Okay. Now, let's talk about first the causes. Dito natin nilagay ang causes. Ano ang causes nitong dalawa? Okay, ang isasali ko lang na causes ay ang two most common. Una, let's talk about iodine. Okay, bakit iodine? Si iodine kasi ay needed by the thyroid gland para siya makabuo ng iyong thyroid hormones, which is your T3 again and your T4. Okay, so kapag hypo, ibig sabihin low ang iyong iodine. 'Di ba? So dito sa hyper, ang iodine mo pwedeng madami. Kasi madami kang iodine. So madaming na nare-release, madaming nakikreate na mga thyroid hormones. Okay, next. Ang other condition na pwedeng cause, condition na nagko-cause ng hypothyroidism and hyperthyroidism are autoimmune diseases. Autoimmune meaning ang ating sariling immune system ay ina-attack ang ating sariling katawan. 'Di ba? Okay. So, memory trick again. Hypo, may O, think of low and slow. Ang autoimmune disease mo dito ay Hashimoto. 'Di ba? Marami ring O. Low and slow, hypothyroidism, Hashimoto's disease. Ang autoimmune disease na yan ay ina-attack kasi thyroid gland, kaya nadadamage sa thyroid gland, resulting to, very low levels of your thyroid hormones. Next, autoimmune disease naman sa hyperthyroidism, think of high and hot. Tingnan mo si high, may letter G. So you think about Graves' disease. It's also an autoimmune disease na nakapag-cause naman sa ating thyroid gland to create and release elevated amount of your thyroid hormones. Another additional information, study hack, yung tinatawag na primary, secondary, and tertiary hypothyroidism. Okay, remember, ang ating hypothalamus, anterior pituitary gland, and thyroid gland. Okay, memory trick. Kapag sinabing primary, diba? Primary, secondary, tertiary, parang levels, parang sa school, diba? So, mag-umpisa ka lang sa pinakababa. Kapag primary, it pertains to the thyroid gland. Yan ang primary hypothyroidism. Ibig sabihin, ang faulty dito or ang may problema is your thyroid gland. Hindi siya makabuo ng mga thyroid hormones o hindi siya maka-release. Whatever the cause is, kapag primary, ang faulty or ang may problema is your thyroid. When you say secondary, pataas ka lang. Secondary, si anterior pituitary gland ang may problema. Okay, may problema sa pituitary gland and sa TSH. Okay, kapag tertiary, si hypothalamus na yan. Kapag tertiary hypothyroidism, may problem sa hypothalamus and sa TRH. Okay, that's all. So, moving on to manifestation. Let's remember again ang functions ng ating thyroid hormones, metabolism, body temperature, sa mood and excitability, increases your heart rate and your blood pressure, and aids in digestion. Okay, let's start with the manifestation. Umpisa natin sa metabolism. So, sinasabi natin sa hypothyroidism, konti or mababa, hindi enough ang iyong thyroid hormone. So, anong mangyayari sa metabolism natin? Babagal. So, babagal ang metabolism. What will happen to your weight? What will happen to the weight of the patient? Anong meron? Yes, weight gain. Kasi mababa ang thyroid hormones mo, hindi makapag-metabolize ng maigi ang body. So, weight gain. Okay. Compared sa hyper, masyado kang maraming thyroid hormones, mabilis ang metabolism, ano namang meron siya? Siyempre, weight loss. Diba? Sinabi ko na kanina, the manifestations of these conditions will be the exact opposite of each other. Okay. Next, sa body temperature, 'di ba? May function ng ating thyroid hormone sa body temperature. Mababa masyado sa hypo. Hypo with an O. So ang patient natin dito sa hypothyroidism ay may cold intolerance. Cold intolerance. So hindi ang patient, hindi ang malamig na environment. So as a nurse, ano gagawin mo? You provide warm environment. Okay? So, opposite lang yan. So, sa hyper, heat intolerance. So, ano naman ang nursing intervention mo? You provide cool environment. Okay. Next, sinabi din natin na ang thyroid hormones natin has something to do with our digestion. So, kung mababa si thyroid hormones, anong mangyayari? With an O, constipation. So, constipated si patient. So, you provide, fluids, high fiber, unless contraindicated. Okay? So, ano naman ang kabaliktaran niya dito kay hyperthyroidism? Yes, diarrhea. Okay. Next. Merong function ng ating thyroid hormones when it comes to mood and excitability. Okay. So, sa hypo, mababa, ano ang patient natin? Weak. So, may weakness, may fatigue, and lethargy. Okay. Sa hyper, merong nervousness and mood swings. Alright. Okay. Ano ang skin natin dito sa hypothyroidism? Dry. So, dry. Dito, sa hyperthyroidism, remember, high and hot, diaphoresis. So, diaphoretic ang patient natin, yung sweaty. Sweaty ang ng skin nila. Sa hair, sa hypo, again with an O, hair loss. Okay? Dito, smooth and soft ang kanyang skin. And walang problem sa hair loss. Okay, next. Remember, may function din ang ating thyroid hormone sa ating heart rate and ating blood pressure. So, kapag hypo, mababa, anong meron? Bradycardia. So, sa hyper, tachycardia. Kasi increase naman siya. Minsan meron pang palpitations. So, sa iyong BP, pwede ring hypertension. Increase ay yung BP, dito down ang iyong BP. Okay, next. Dito, si hypothyroidism, merong generalized puffiness around eyes. Sa eyes. Okay, ito ang manifestation ng myxedema. Okay. Next. Dito naman, exophthalmos. Ano ang exophthalmos? Bulging eyes. Bulging eyes or protruding eyeballs. Okay. Next. Si hypothyroidism, please note, meron siyang menstrual disturbances. Or yung iba, merong amenorrhea. Okay. I would like to note na sa internet or sa ibang sources, marami kayong makikita na mga manifestations ng hypothyroidism and hyperthyroidism. Itong mga list ko ay makikita po sa Saunders Comprehensive NCLEX RN Review material. Okay, last na manifestation, kaya ko siya hinuli kasi pwede siyang mangyari in both condition. What is that? Yes, that is the goiter or the enlargement of the thyroid gland. Yung lumalaki na mismo sa thyroid gland. Okay, most of the sources, sasabihin na mostly common siya sa hyperthyroidism kasi overly stimulated ang ating thyroid. Well, pwede rin siyang mag-manifest in hypothyroidism. Why? Kasi pag may hypothyroidism, overly stimulated din si thyroid gland. Kasi, remember kanina yung feedback mechanism, magsisend ng signal si body, wala kaming T3 and T4. So, the brain or our hypothalamus and anterior pituitary gland, magsisend yan ng mga TSH, TRH and TSH, and that would stimulate the thyroid hormone. So, overly stimulated din ang ating thyroid hormone sa hypothyroidism. So, pwedeng meron siya. So, possible na meron din siyang goiter. Okay? Next, ano ang fatal? Okay, ano ang fatal condition when it comes to this disease? Okay, ang fatal complications. Okay, sa hypothyroidism, anong pwedeng mangyari? Myxedema coma. Remember, hypo low. Sa myxedema coma, lahat mababa. Okay? Remember, lahat mababa. Anong mababa? Mababa ang BP, mababa ang heart rate, mababa ang temperature, mababa ang pwedeng electrolytes, especially your glucose, pwedeng may hypoglycemia, magkakaroon ng respiratory failure, and of course, may coma. Nandiyan na sa name, myxedema coma. Okay, ano ang fatal complication dito sa Graves' disease or sa hyperthyroidism? Masyado kang maraming thyroid hormones. So, anong pwedeng mangyari sa'yo? Thyroid storm. Okay, ano naman meron sa thyroid storm? Kung dito lahat mababa, sa thyroid storm, lahat mataas. Okay, lahat mataas, your vital signs, your temperature, your heart rate, your BP. Meron kang irritability, agitation, and confusion. Remember, ito ang early sign ng iyong thyroid storm. Early sign of thyroid storm. Okay, irritability, agitation, confusion, and restlessness. Okay. And pwede rin siyang merong delirium and coma. Okay, let's move on sa treatment. Ano ang treatment sa hypothyroidism? Anong kulang ka? Thyroid hormone. So, ano ang ibibigay sa'yo? Of course, your thyroid replacement hormones. Ang pinaka-common is your levothyroxine. Okay? So, sa levothyroxine, kung nagbibigay ka ng thyroid replacement hormone sa yung patient, of course, we monitor for the overdose naman sa thyroid meds. Kasi pwede naman siyang magkaroon ng hyperthyroidism kapag masyado ka ng madaming levothyroxine. Okay, ano naman ang treatment dito sa ating hyperthyroidism? Madami ka ng thyroid hormones. Anti-thyroid medications naman ang ibibigay sa'yo. Okay, ang common dito ay yung PTU or yung propylthiouracil. Okay? Alright, so I think that's it for hypothyroidism and hyperthyroidism. Remember, kesa i-memorize natin isa-isa, all we need to do is to understand the functions of your thyroid hormones. That way, kahit pagbalik-balik ta rin nila, you can still, manage to answer kung ano mang quiz ang ibibigay sa'yo ng teacher, or much better, masasagutan mo ang PNLE, lalo na yung mga critical thinking questions that you need to analyze talaga. Kasi kung i-memorize mo lang to, madali mo makakalimutan. But if you understand, if you have the basic, foundation of the physiology of our thyroid gland and your thyroid hormones, there's better chances na masagutan natin ang question sa PNLE. So, that's it. Bye!